My name is Barbara Israel. I'm on the faculty at the School of Public Health at the University of Michigan, Department of Health Behavior and Health Education, and am one of the co-principal investigators, along with my colleague and friend Erica Marsh, of the Michigan CEAL project. A little bit about Michigan CEAL. We're working to enhance and increase understanding and knowledge and reduce COVID-19 inequities, particularly in communities that have been the most impacted by the pandemic. We are using a community-based participatory research approach, a partnership approach involving community partners and academic researchers in 4 counties that have been most impacted. These counties are Kent, Genesee, Washtenaw, and Wayne. This is our 6th webinar. We welcome you to the webinar that's being sponsored by Michigan Communities Conquering COVID, and just delighted you're here joining us tonight. I'm particularly delighted. Well, before I go on to introduce, let me introduce our Spanish translator, Maria Militzer, who's going to give some instructions.
Si todavía están en el canal de inglés, asegúrense por favor de cambiar su canal a la línea en español y ahí nos encontraremos. Gracias.
Thank you, Maria. And just to provide a little more introduction, Maria will be providing our Spanish translation tonight. She is a community leader working in the Latinx community and with families through Mexicans in Michigan, a nonprofit community-based organization. So we are most appreciative and delighted that she's providing translation for us tonight. So again, I am delighted to have several of the community partners that are part of Michigan CEAL on this panel tonight. As I think you know, our focus is on examining why a participatory approach between community and academic researchers is critical for understanding and addressing the COVID-19 pandemic. I want to briefly introduce our panelists and then give them a chance to say some opening comments, then start with some questions, some of which we've received from those of you who registered, and then you're able to put in additional questions that we'll monitor in the chat and try to get to those questions as well. So we have with us tonight Zachary Rowe, who's Executive Director of Friends of Parkside based in Detroit. Ann McCollum, who's president of the New West Willow Neighborhood Association in Ypsilanti. Susie Williamson, who's the community health educator at Spectrum Health, Healthy Communities in Grand Rapids. And Ella Greene-Morton, who's the administrator of community-based organization Partners, the Community Ethics Review Board. And also Sandro Cinti, who's professor of internal medicine and infectious disease at Michigan Medicine. And Sandro, this is his 6th time joining us. He's been part of each of these webinars. We really appreciate your involvement in them. So with that, I'm going to turn it over to my colleagues and friends to hear from them. We're in for a real treat this evening. I want to start with the question, or giving you all each a 2 to 3 minute time for opening comments or remarks to this theme of our session tonight, which again is, why do you think a partnership participatory approach between community partners and academics is critical to addressing COVID-19? And so I'd be glad for anyone to get us started, and then we'll move through our panel before we open to other questions.
I can start.
Thank you, Joanne.
I have to put my thoughts on paper. They get lost if I don't. So I think this approach is critical because it carries a feeling of ownership and builds a base for intervention, and everyone has a voice. For the most part, everyone's perspective is being considered, and I say the most part because sometimes we can't get everyone's perspective, but we do get as many as we can in this approach. And I enjoy learning new skills with this approach, like looking at data which I thought I knew how to read data, but I'm learning better ways to interpret data, and how this detail in the process is relative. It's establishing ties among community members, and that's very important. It exposes the strengths in the community by making assessments of what can be used. And mostly what I like about it is it knocks down myths that can be harmful to the community. So that's why I like the participatory approach. Thank you.
Great. Thank you. Very helpful.
I
So
like-
who would like to follow?
I will go next.
Okay, Susie.
Oh, I'm glad my mic is on because I was talking before and it was off, but so happy to be here. And like Joanne, I do have something written, so I'm gonna look at it while I'm kind of reading from it just to spark my memory here. I think this is very important because to me, it's like a shared leadership initiative between the community and the people who do the research and data. I always go back to this phrase, it takes a village to raise a child. It takes everyone. It takes a village to address the concerns, fears, aspirations of a community. I like this type of research because it gives the community a voice, and it teaches researchers to actively listen to the community, not just listen to respond, but listen actually to hear and to feel the heartbeat of the community, what matters to them. Because oftentimes communities are told what should matter to them, whereas we don't take into consideration all of the nuances that make up communities, the values, the traditions, all of this plays a role in how a community works. And communities are very exciting places. They are full with people who have great ideas, but they want these ideas to actually be listened to and not just them telling over and over what's needed in the community. So through this research, to me, it feels like a partnership, and everyone has a part of making the community, all our communities work and conquer whatever COVID or whatever comes their way. And it's just a great working relationship. And I think these relationships that are built during this time have a potential to be a lasting relationships where trust is built. And unfortunately, a lot of communities, and that is the root of communities, are hesitant in participating, and just because of the trust. If we could build that trust back in communities and let them know that they do matter, and we just don't want information from them and then just leave and use our research for whatever, but actually making them a long-term commitment to community. So that's why I love this type of research.
Great. Thank you so much.
Well,
Who wants to go? Ella, please.
Yeah, so for all of the reasons that were shared by Joanne and Susie, but also when I started to think about the question why it would be critical, I thought also about longevity and the fact that many of our, not necessarily the partners just here with CEAL, but across partnerships, and especially for many of my partners in Flint, we've been participating in this type of engagement for a long time. I was introduced to it way back in the early 90s. And it allowed us to, for me, thinking outside of the box, learning new things, but being engaged in work that's beneficial to our communities in so many different ways, right? And also understanding that with the way COVID came upon us and the destruction that it brought and all of the things that we had to consider, I'm thinking that had we not had this in our belt, under our belt already, we would have had to do some major pivoting. But we, across the state of Michigan, we had been engaged in this kind of work. We knew how to work together. We knew who to go to for, when we had questions. We knew that we had folk in place that we could trust the information that we were getting. Even when we would hear stuff from a national level, we knew that we had local folk from our different institutions and from the different practices that we could actually talk to and get a deeper understanding. Okay, I know I heard this, but how does this relate to me? So it put us in a position where we were ready. I think we were ready to approach this, even with not understanding everything that was happening or that is happening with COVID and the ups and downs of COVID, just understanding that we have this group that we can actually turn to and dissect whatever is given to us. We don't necessarily agree to all of it. We don't instantly understand all of it, but this participatory approach allows us to get our questions out. And because of this long-standing engagement that we've experienced, it really allowed us to put ourselves in a position where we could just move forward with this process, not knowing what tomorrow is going to bring, but knowing that we're in a position where we can actually make a difference and keep it moving.
Great, thank you, thank you. Okay, Zachary, you ready to go next?
Sure, I'll go next. I was listening to Joanne and Susie and Emma sort of speak, and I just wanted to say ditto because I agree with everything they said. And I was thinking, what could I add to the conversation? What could I say that have not already been said? Right? Sometimes, that's not possible. So sometimes you have to repeat what's already been said. So with that being said, I think I just really want to sort of emphasize and lift up the word trust. The whole issue around COVID, I mean, there's so much distrust in the community around COVID that it's overwhelming at times. And just being able to work with our academic partners around that issue have been really helpful to me personally, right? Because I felt like I can reach out to our academic counterpart and sort of ask them those sometimes those stupid questions and get a sincere answer, But also it wasn't just me, but also just being able to reach out to our academic partners and make their expertise available to the community have been really helpful. But in the process of doing that, though, I can sort of see people starting to develop that needed trust in this process, because there's, you'll be amazed at how much distrust is out there around COVID, right? I'm not going to say anything about our previous president, but and so I think we're going to get to this topic later on in the conversation when we talk about sort of the disinformation out there, but having a trusted source that I trusted, that I can make available to the community have been really helpful. And I think everything that the other speakers have sort of said about the process and the partnership, I definitely agree.
Great, thank you, Zachary. Sandro, you want to jump in here?
Oh, this is great to be here, and I'm so honored to be here with all of you. I'm an academic, and I love coming to these. These have become my favorite sessions, because in academia, we all sit around and think we know everything and know the answers to everything. And actually, I realized I don't even know the questions sometimes. And so coming here to have this discussion and really trying to understand what it is we have to go back and read about and learn about and talk to ourselves about, I think it keeps me coming back every time. So thanks for setting these up. And I'm happy to answer anything, but I really like to listen to everybody's ideas and thoughts and how you get into your communities and help them understand that getting vaccinated is the right thing, that managing COVID is the right thing. So let's get going. It's great.
Okay, thank you so much. So just a quick comment here. I mean, again, really appreciate these opening remarks. And there's clearly a lot of common themes that came up from your comments that I think are really important. Issues around trust, issues around ownership, issues around being heard. I love the comment about faculty learning how to listen, and not to listen to respond, but listen to really hear. And I think that distinction is so critical in doing this kind of work. And again, just really value the insights that you all are bringing to this conversation. So just moving on to a couple other questions. And again, some of these are questions that we received beforehand. But want to look at what are some of the current issues and challenges around COVID-19 that your communities are facing. Again, everybody doesn't have to answer every question, but like to get some thoughts on current issues and challenges around COVID-19 that your communities are facing.
I think I'll go. Just I'm very, very concerned that communities now are feeling that they could relax a little bit, and they are not really taking COVID as serious as they did in the beginning, because everything is opening up, masks is not required anymore, and they're not even hearing the variants that is coming. They don't, it just like bounces off, and just that, oh, we came so far, and now it almost feels that we have to drag again back to that seriousness point, and just feeling a little anxious about that.
Yeah, absolutely.
I
Ella.
think another concern, I'm so sorry. Another concern is we talk about hesitancy, and I've always pushed back on that word a little bit, because it goes, for me, it goes much deeper than hesitancy, because there are, groups or pods, segments of the community that I don't think they're hesitant. They've just decided it's a no, a strong no. So we have to, as a community, we have to continue to work and try and understand and recognize that it's a person's right, to feel and believe the way they feel and believe, but also taking into account, what we're dealing with and how it impacts us. So it's an ongoing conversation. It's an ongoing dilemma on how we will continue to, live as a community with the different perspectives of this, and continue to try and share our points of view, but also be in a position where we have to accept other people's points of view and understand how to live with that. And that's huge.
Absolutely.
Yeah, so I guess I want to add, I guess my point I want to add is one of the biggest challenges is understanding and being able to address folks' need for more information. I think like Ella said, I mean, there are people who are definitely, flat no way, no how. But there are folks that they're on the fence. They just need more information. They're not sure what information they need. They just know they need more information in order for them to make their decision. And I guess the challenge is understanding what information they need and in what format or what fashion they need to get that information, right? That's sort of one of the biggest challenges, just sort of understanding that. Because we can cite all kinds of status, statistics, or we can point to all kinds of governmental sources, and it's still not moving the needle. And I guess we got to do a better job of understanding what question they're really asking, and to be able to do our best to answer that question in a way that's helpful, respectful, and meaningful to them?
Great question. And I think we'll come back to that, but really good question. Other comments on challenges that your community's facing? Right
Yes.
now, please.
In my community, we have, because of all the, things that are happening because of COVID-19 and what we've gone through, there's financial hardships. We live in a food desert, so there's a challenge there of getting fresh fruits and vegetables. Seniors who are isolated, but our main issue is mental health. And mental health is a concern. There's been a rise in my community of detrimental behavior when faced with adversity. And that's our main issue that stands out more than anything is that behavior. We notice that, at our neighborhood watch meetings or, people talking to one another, you hear people having a hard time in coping in situations, and they will choose a behavior that is harmful to themselves and to others. So those are the main issues that we have in my community right now.
Thank you.
Just to comment on the, in my community, which has been the hospital setting, mostly over COVID, I think it's kind of an echo chamber of not understanding why people don't get vaccinated and putting hesitancy into one bucket and not understanding the nuance that you guys are bringing up here, that it's different in different communities. And it's tough to get that message across. I wish I could bring all my colleagues out into the community to speak with others, because it really enlightens me on those topics. So I think we need to do better. And I've come to tell my patients, I'm your consultant. I'm not the person who's going to tell you what to do. And I think as a health system, as a healthcare forum, that's what we have to put ourselves out there as. We're here for you to ask us questions and for information, but not to tell you what to do.
Nice, nice.
I really like the way Zachary put that question. It really kind of resonates with me about people trying to figure out what they need to know. I forgot I should have wrote it down, Zachary. You said something like, do you remember what? I need to write that down because it's really profound. It's like they don't really know what they need to know, but they need to know it. And you put it in a phrase and I forgot it, but that's very important.
Yeah, absolutely. Well, it is recorded, so you'll be able to go back.
Oh, great. Zachary was like, I don't know. But
So just, building off and talking about the challenges that you've identified, and if you come up with others, what are some of the strategies or strengths or resources in your communities that you've been drawing upon to try to address these challenges?
I can talk about strategies. So being connected with the community-based organization partners, we intentionally started to have meetings to work on strategies, because what we wanted to do as community partners, we wanted to be in a position to be able to share information with other community members, other community households. And we wanted to be able to share accurate information. So we're a group, we're spread all over, but many of us participate in the task force that was set up to deal with COVID. So a local level task force with many subcommittees, the faith committee, health committee, number of subcommittees. And we were able to gain information from these folk who were our academic partners, our practice partners, our business partners from all different sectors, but gain information that we could discuss and come up with information that we could share with our family members first, but other community members on exactly what's going on, what this means, how we need to address this. You know, what can we do about getting access to vaccines, all of that, right? So that was a strategy that we started with, to be able to share, even creating one pagers to provide to folk that they could put on their refrigerators or wherever, that they've got this information handy, you know, that they needed to wear a mask, they need to wash their hands, they need to distance themselves, all that kind of stuff. But really addressing the issues and the questions that they had, but not bringing information from me, the person, but from the experts that we work with. And that was really helpful.
Nice, thanks.
Yeah, so if I can chime in, and I think this is a really great question. You know, and I would sort of say hands down, our greatest strength and one of our biggest strategy had to do with volunteers, our board members and the residents who lived in the development, who volunteered to help out. I mean, without the combination of our board and our volunteers, there's no way Zachary Rowe would have gotten anything done. And then also just knowing that we had this richness of supporters that we can reach out to. I remember being in my office and getting emails from, you know, some of our academic partners sort of saying, hey, you know, how can we help? How can I help? Right. And I'm thinking, I don't know how you could help. And so, and I say that in honesty because I really didn't know how people can help. And so just talking with the volunteers and the board, one of the things that we came up with is this thing called application for resources. And they said, whatever you do, don't call it a survey. Don't call it a survey. Because the survey is that people want to know things, but they're not going to do anything. And so the application for resources, we use that to understand what residents needed during the COVID, right? Some people needed food assistance, some needed household items, some needed financial assistance, but it was a way for us to capture exactly what was going on in the community. And instead of sort of saying, well, I think this is what they need, I was able to articulate exactly what they needed because they told me, right? Mm-hmm. If anybody know about Friends of Parks, I would tell you in a minute, we have no money, but we know a lot of people, right? And so we were able to look at, we were able to connect those resource needs of residents with people who had the resources, right? So, I think for us, we played that sort of facilitating role, and it was really helpful. But one of the things that we did was we asked residents. We found very creative ways, and we started sending out text messages to residents that had a link to this application for resources. For folks who didn't have access to the internet, we called them and we collected the information over the phone, right? So we didn't want to miss those folks. But we could not have done any of that, without our volunteers, our board, and our academic partners like MICHR and like Private Solutions and the URC. All of you guys made it possible. So thank you.
Thank you, Zachary. Any other comments on? Yes, Susie, please.
Like Zach and Zachary and Ella said, it's a kind of we call it all hands on deck, real quick. I like our theme, the urgency of now. And so from the top down, we did media blitz, all of the VPs of all the hospitals here. They did a media blitz on TV during news time about COVID, and we kind of cascade down from there. Then we got into the school. We had everybody. it was really beautiful when everybody gets on board. The school system, the hospital, the community centers, everybody was out there saying the same message. So people would not get confused. It was the same message. And then we cascaded down from a big old event to going into individual communities, to going into individual churches and talking to people. We have these wonderful people called community health workers that actually went into the homes and also spread. So we were trying to hit it from every angle that we could to make sure no one was left behind and everyone knew and had the information. But like Zachary said, some people still needed more. They just needed more. And like Ella said, you have to respect that. They just needed more. They still weren't sure. And I could respect that too, because, you know, I've been through the healthcare system. I work for healthcare, 2 masters, and I still get nervous sometimes. I still remember the past and what happened. It took me the longest time to be an organ donor because I was afraid that if something were to happen to me, would I be saved or would my organs at this time in history? So I definitely understand.
Thank you. Thank you.
Yes, in my community, we, the neighborhood association partner with the health department, Ann Arbor Area Community Foundation, United Way, Office for Community Economic Development, the Washtenaw County Sheriff Department, Habitat for Humanity of Huron Valley, Journey of Faith Christian Church, Ypsilanti Charter Township, and our neighborhood churches. And together, we came together, and through these partnerships, the community was supplied with vaccines, food, and they were supplied with money for bills, PPE supplies, educational information on the virus. And our main challenge still, though, is the mental health. And so that is something we are strategically working on. Right now, the health department just received a van, and we're hoping to use that van to come out into the community and help with things that, you know, one of the things is mental health.
Great, thank you. So I'm going to take a quick Dr. Militzer break. Do you need a water break or a pause from translating? Are you good for us to keep going? Okay, let's take 2 minutes. Okay. All right. We're speaking a lot about people's needs, and I want to be sure we're receptive to the needs of our translator, who's graciously working really hard to communicate to our Spanish speakers as well. So thank you, Maria. Really appreciate it. It looks like she's already back at work. Okay. Let me, we got another question that has come from our audience, and I want to go ahead and add that in because I think it builds on some of the questions and things that you all have already brought up, which is how do we bring into the information into the community that is understandable? So a lot of you have talked about, you know, misinformation, people not knowing what questions to ask. How do you bring information to the community that's understandable? Thoughts, reactions?
Well, I can make a comment about that. Very early in the beginning when we were vaccinating, I was part of the vaccination task force at the University of Michigan, and we were vaccinating our healthcare workers. And as I said, we you know, sometimes we didn't even know the questions. And so at a certain point, we just started circulating throughout the hospital, and we would go to different areas of the hospital and listen to what people were asking and wanted to know about. And it was very enlightening. And sometimes we had to go at 11:45 at night. I went once just to be in a group where these people were shift workers, and they were coming in, and there would be 60 people there, and they all had a lot of questions. I didn't know that I could answer everything, but at least I could put some light on some of the more glaring kind of misunderstandings that were out there in the media, that were out there on Twitter, and we needed to do that, and we need to continue to do that. I think at every point where we think we've reached everybody, we have to look around and say, hey, have we really reached everybody? And almost every time the answer is no. We've got to keep going. So I think we have to do that outreach. There are resources out there where we can use those to teach to bring information to folks, and I want to keep doing that.
Great, thank you.
I think another thing that we have to consider in trying to push information out into the community is recognizing that most of our communities are communities within communities. So you have so many different groups that would need information. So even, you know, when we're pulling people together to work on different pieces of this, just making sure that you're pulling everybody in, that everybody's invited to the table, because, you know, there are folk that I know that I can take a message to, but there are other folk who need to hear from people that they know, right? So it's just important to make sure that we've thought about that. It's not, you know, just one, it's multiple communities within our community most times.
Just to piggyback on Ella, yeah, some communities even feel that they're not the one that you're addressing, so they don't even bother to get the information because so many times they're left out. So, you know, just getting that word out that we're here for everyone and that we want to hear from you and make it possible for you to be included in this process. I think that's a big message that needs to go, because people will just turn you off without even considering that, this time you have something that I could understand that relates to me, but they never get to that point.
Yeah, you know, the other thing I would point out is that unfortunately, information is not static, it's dynamic and it changes. And that's problematic because people watch the news or they watch the video, and, you know, the information that we gave them yesterday is no longer true, no longer relevant because things changed. And so how do you sort of create that kind of relationship whereby you can have these ongoing conversation with folks even while the information is changing? That's sort of, you know, the challenge, you know, because, you know, every day there's some new information or different information about COVID, and it just sort of goes to make people, you know, more nervous, or it sort of feeds into, you know, the reason why they're reluctant to take the vaccine or trust the information, because it seems like it changes constantly.
Great point.
I think one thing is to actually put that out front, to say that, to be honest with folk, to say, you know, this is what we have today, this is what we believe today, but this is what we know today, but we don't know if it's going to be the same thing tomorrow. And keep saying that, you know, and that's all we can do, because if we do anything else, we're going to come out looking like folk who are not trustworthy, because, you know, we pushed something that wasn't true. So you've got to put it out there.
Yeah, and I'm noting that too, Ella and Zachary. Thank you very much, because I think academia gets out there very often and says things definitively, and then changes, and then things suddenly change. I've done that. I've been guilty of that, and then suddenly everything I said was wrong. And we really have to come out there and say, we know this is going to change. What we know right now is this. And I think that's part of the problem the CDC has had, that information, you get whiplash because you're turning to the other side to see what's coming.
That's great. So sort of related to that, I'm thinking maybe a little bit more broadly, but, you know, what do you consider to be the largest or one of the greatest community needs specifically around vaccine access? And how do we increase vaccine access and uptake, but, you know, sort of bundling that together?
I'm sorry.
Zachary, you're laughing, go for it.
No, I'm sorry. Can you repeat the question? I'm sorry, because the answer was too simple.
Well, give it to us, because I don't think we figured out how to do it. If you look at the percent vaccination rates, say in Detroit, for example, where I just recently heard from the head of the health department, is the rate is 37%. And clearly that's not high enough. So from a perspective of, herd immunity and protecting larger groups of people. So what is it we need to do to try to increase vaccine access and uptake?
I would say that we have to continue doing what we're doing. There might not be a new thing to do. I remember hearing that some of so many of the folk who have received the vaccine were those folk who were ready to do it. We vaccinated that number, right? And now we're working on those who are somewhat hesitant or on the fence or need more information, and we're getting those folk. But I think also to allow what works to work in our community, I think there was mobilizing of everybody. We had our faith-based groups working. We had, we created additional vaccine clinics. We even figured out how to get some of our folk who were not able to access the online application or request, so we just, who said all hands on deck. We figured out how to create almost these phone trees to get folk to the centers to get, and some of the cases where there would be leftover vaccine and that if it's left over that day, they had to throw it away, right? So we even created a process where there would be folk that we could get to in the right age group, but get them there so that wouldn't be a waste. So it was really about using all of our resources and just continue, even when it seems like it's not working. I think it was working. Even now that it seems like it has really slowed down, it's still working because folk are still changing their minds. Those folk who are going to, they're still coming in. So we just have to continue to do what we're doing.
Nice.
I just want to echo. I'm sorry. Want to go ahead?
Oh, okay. I just wanted to say that, and I hate to say this, but it's not to look bad on the community, but it's just not a priority. When you think of all the things that communities are facing, homelessness, domestic violence, mental health, mental illness, trying to get someplace to get a vaccine is just not on my mind right now. It's not a bam in my face thing. I'm gonna die tomorrow if I don't get it. So I got other things I gotta take care in the meantime. That's crucial to my survival.
Yeah. I just, so basically, I want to sort of echo both points. I think basically, we got to try everything. I don't think there's like one answer or one simple solution. So continue to sort of try everything, right? And I think also we maybe have to sort of shift our focus from trying to vaccinate large groups of people at a time. So you may not get the 100 or 200 or 500 people that comes out. You may just have to look at being happy with just vaccinating one person or 5, right? So now instead of looking at big numbers, maybe we need to start looking at smaller numbers and be okay with that, right? Also, I think there's this push to try to make it more accessible and more convenient for folks. And the more we do that, the more we normalize the vaccine, the better, the better uptake we're going to see in the future. But so just, focus on smaller numbers now, the 3 to 5, group, and being okay with that. And also trying to make sure it's, it's convenient and accessible everywhere.
Great. Thank you. So just on a somewhat different tack, again, this was a question that was brought up by, a participant having to do with any updates on booster shots. So the question is, that there's news that a booster shot may be needed 6 to 9 months after the second shot of Pfizer BioNTech. There are many individuals that are almost at that 6 to 9 month period. Are there any discussions about booster shots starting soon? What is it we know at this point? And with that caveat, what we know today may change tomorrow, as was so eloquently said. So, Sandro, you want to start?
Yeah, I can start with this because I actually had to do a grand rounds for our doc. So I just looked this up, and there is a lot of work going on boosters and even third doses for people who are immune compromised. None of that is accepted at this point, but they're saying, what if there are some centers that are trying to do extra doses. Good news is that Pfizer has looked at their data and that this vaccine is protective up to 6 months, very protective, Pfizer and Moderna. And so I think we're good past 6 months. The question will be, will we need boosters after 8 months, 9 months, 12 months? The thought is probably, but we don't know that for sure. And so I think they're going to go back and keep looking at how are the people that we vaccinated now doing? And if people are doing well, maybe if the efficacy turns out to still be 80, 90% at a year, maybe we don't need to do boosters. But that'll change. Again, those things will change. The studies are being done now. There's nothing out there for sure. The expectation is yes, that boosters will need to be done. But again, it may be good news. I think we should expect that may be the case, and we'll plan that way. But we'll see.
Very helpful. And at this point, we don't know whether a booster is 1 more shot, 2 shots.
Right. I think right now what they're considering is it'll be a 1 shot. Now, will it be 1 shot of the one you got, or will it be a shot of something else? They're looking at what's called, they're looking at, can you get a shot of Pfizer and then Moderna? And so they're doing those studies now too. And then some of the evidence shows that you may even get a better response by getting another type of vaccine at some point. So again, more will come out, and we'll have to look at side effects with those too. So stay tuned, I guess I could say.
Okay, a great
I'll
question.
be back in a month, so we can talk about it again.
Okay. It could be an ongoing question for every webinar. No, thank you for the person who sent in the question. Thanks, Sandro, for your response. Anybody else want to comment on boosters? I think we're still working to get people to get that first shot, right?
Yeah, I guess I would ask you guys what you think about people who have gotten the shots. Do you think they're willing to get boosters or not? What do you feel out in the community?
I think they are.
Okay.
And I don't know that has been a huge conversation among my peers. I don't know. I haven't heard folks say that, I did the 2 and I'm not doing anymore. So it sounds like they might be open to it, but I don't know what the consensus is. Personally, if it's something I have to have, I know I'll take it.
Me too. I'll take it.
I'm sorry, go ahead.
The few people that I've heard from in my community would not. Because they did not like the reaction they had after the 2nd shot of Pfizer, I think it was. And so when the issue came up about, well, would you get a booster? They said no.
Oh, that's really good to know, actually, to be able to know that ahead of time, to do education. Yeah.
Right, about side effects. And, Zachary, did you want to jump in here?
Well, yeah, I was just sort of thinking, the challenge with the 2nd shot and with the booster is that you're not really sure if the vaccine protected you, right? You have no way of knowing if it actually worked, except that you didn't catch the virus, but who to say you was going to catch it anyway? So I think those booster shots are going to be as problematic as the first shot.
Good point.
Interesting. Very interesting. So let me I know we're almost out and want to leave some time for some wrap up at the very end, but just want to give you, again, I can't thank you all enough. This has been so insightful and meaningful and powerful. But just want to give everybody on the panel a chance to say any parting words or comments that you might, reflections, again, back to our theme about the benefits of using a participatory approach involving community and academics in partners in addressing the COVID-19 pandemic. So.
Well, I've really enjoyed this panel. I've learned some things that I'm going to take back to, again, strengthen my push for everyone to get vaccinated, and thinking about some of the information that was shared by the other panelists on ways to engage people and ways to think about why people are not engaged or ready to get the shot, and just kind of reimagining what I could do to make that better. So thank you, panelists.
I'll say thank you as well. I came into this convinced that, you know, using the participatory approach was the best thing to address COVID-19. And I'm even more convinced now after hearing from my colleagues from across the state and the work that they're doing, and how it just makes sense to me. I can't see us doing it any other way.
Yeah, I just want to thank my volunteers and my board members for being there initially at the sort of the start of the pandemic, because like I said earlier, without our board, without our volunteers, we could not have managed to do anything. Also, I'd like to sort of thank our academic partners for answering the call. You could be amazed how many emails I sent out to different academic researchers for assistance, and all of them responded. One even responded when she was on her sabbatical, so she knows she is. I don't need to sort of say her name, and that was cool. But thanks for answering the call.
That's great.
I want to say that I very much appreciate this approach. I believe that this approach has helped my community. It has knocked down myths, that generational myths that have been harmful to communities like mine. And so I am very grateful for this approach, and it's given me very much hope that the health equity will become stronger.
Yeah, I think we should continue to do these in perpetuity, so that we can, and there'll be other issues, right? It won't only be vaccination and COVID, there'll be other issues too. And we need to know, we need to have our fingers on the pulse. I mean, we do it in the hospital all day. And we think we know we think we know the way things are going, and we often don't.
Nice. Well, I want to again personally thank each of you for, again, the very insightful comments. Thanks, Maria, for your excellent translation. I want to turn it over now to my friend and colleague, Erica Marsh. We'll say a few other closing comments and also talk about the next upcoming 7th, one of these webinars, which will happen in about a month. So Erica, please.
Good to see everybody. Thank you so much, Barbara. And I will start by saying thank you for your excellent moderation of our highly esteemed panel members. I was too chicken to do it, so I'm glad you stepped up and hosted this panel. No, I'm just kidding. Barbara, you have such a decades-long track record of community engagement and CPPR, and when this topic came up, I could not think of anybody more appropriate to moderate this session than you. So thank you so much. And for your moderation, for your friendship, for your partnership in the work that we do together as well. I also have to thank our esteemed panelists, our community members who are here tonight, and those who are not here who continue to educate, to school, to enlighten, to uplift, to do all of the things that we need you to do, who've talked tonight about inclusion, about representation, about trust, about access. But I think the word that most resonates with our community leadership here and in the community is just survival. You get it done. In times of feast or times of famine, you hold your communities together, you get them through. And it's such a privilege to partner with you, to learn from you, to learn about resilience, to learn about survival. So thank you for your voice. Thank you for your wisdom. Thank you for your insights that you have brought, that you brought tonight, and that you continue to bring and to share with us. It means more than you know. Dr. Cinti, last but not least, you have attended and been present at more of these events than anybody. So thank you for being here, for bringing the detailed expertise that helps us have a trusted source that we've been talking about, a source. You are a voice now that so many of us turn to get the best information that's available, with the caveat, it may not be the final answer, but as of today, at what time, this is what we know, and we appreciate you sharing that with us. Also want to thank all of the people who are behind the scenes that our listeners and viewers may not be able to see, who make these town halls possible. Patricia Pachowski, who's a project manager for MICHR, and my right and left hand on all things MICHR, Amber Washtenaw, who has been present at all of these events and make sure they run smoothly, and our Director of Communications, Amy Rooker, who's here tonight. Barbara has thanked Dr. Maria Militzer, who is based at the U of M School of Public Health, but also has an equally busy life working with her nonprofit organizations, the Mexicanses in Michigan, working with Hispanic and Latinx families across the state. Dr. Militzer, thank you for all that you do, for making sure that this message, these panels, are accessible to so many more people than they otherwise would be. I want to let everybody know that we hope that you can join us and return for our next event, which will be on July 27th, and will be a youth and young adult focused Michigan Communities Conquering COVID session. That's one of the population segments where we need to see more traction. So folks in their late teens and early 20s, or their teens and 20s, will be the focus of that discussion. And we're hopeful that the following month in August, that we'll be able to host a panel focusing on even younger cohort, that the youngest cohort who can be vaccinated in that 12 to 15-year-old cohort, but we will be in touch about that. So we look forward to seeing you Tuesday, July 27th at 6 p.m. Same station, same time with the new panel. And I want to, on behalf of MICHR, on behalf of Michigan CEAL and our Communities Conquering COVID Steering Committee, on behalf of our other co-partners with Michigan Medicine and Alfreda Rooks, who works with Michigan Medicine and Community Health Services, and the many, many partners that we have out there that make these events possible. We want to say good night and thank you. And I'm gonna just hand it over briefly to Tricia Pachowski to see if there's any other announcements that we need to make.
No, I did want to tell everybody we didn't get to all the questions, so I will put them in the queue for our July event. So if your question is burning, just know we'll get to it and it'll get answered.
Wonderful, wonderful. Thank you, Tricia. All right. I think on that note, it is 7:01, so we are 1 minute over. We will say good night. Thank you so much for joining us, and we look
Thanks,
forward to seeing
everybody.
you next
Bye,
month.
y'all.
Thank
Thank you.
you.
All
Really
right.
appreciate it.
Bye-bye.
We are off the live stream.
Wonderful.